Okay, everybody, we will go ahead and get started. My name is Kelsey Nelson. I work at Boise State University, and I have the pleasure of moderating today's panel. We have three wonderful panelists that have taken time out of their day to come speak with us, and really excited for this conversation. Before we get started, just a little bit of housekeeping. We're going to ask for, the beginning of this panel to really leverage that chat that we have. We've got a lot of questions that people have submitted and hoping to get through those. But if at any point you have an additional question or something clarifying, whatever it is, please feel free to use the chat. We've got Haley and myself helping to monitor that, so you can get those questions answered. Now we're going to go ahead and jump on in and get to know the panelists a little bit. Panelists, we'd love to, maybe go down one by one. We'll start with Julia. We'd love to know your name, where you work, and why you're excited to connect with Boise State students on this panel today. So Julia, if you'd like to get started.
Yeah, thank you. So my name is Julia Nigro. I am a recruiter with St. Luke's. I've been with them for 6 years now in their talent acquisition and recruitment team, and really excited to connect with you guys because I'm also a graduate from BSU and probably share some similar experiences that you all have been through, and just happy to connect you to some insight into opportunities and how you can build your career from where you're at to now.
Wonderful. Thank you, Julia. Anita?
Hi, my name is Anita. I work at the Idaho Community Health Center Association. I've been here for almost a year now. I'm excited to be here. I graduated my undergrad and my master's just this last May from Boise State from the School of Public and Population Health. So I'm really excited to be here and kind of show you all a new field of work that I discovered when I was applying for jobs. So hope I can share it with all of you.
Thank you, Anita. And Brady.
Yeah, hi there. My name is Brady White. I am the practice manager for St. Alphonsus Cancer Institute, so regional program stretching from Ontario, Oregon to here in Boise. Excited to kind of meet with you all and kind of tell you the wonderful world of kind of clinic operations and healthcare. Lots of opportunities for growth in positions. So.
Awesome. Thank you, Brady. I'm stopping sharing my screen. So we'll just dive into questions. And the first question that we have is, what was your career trajectory like, and what key decisions led you to your current role? So whoever wants to chime in, not everybody has to answer every question, but if you all have something to say, you're more than welcome to chime in.
Yeah, I can share. So, my career trajectory, as I shared, I was with BSU and I gained my Bachelor's of Science through BSU, and later completed my master's MBA. But when I was there at BSU, I was always drawn to healthcare. Just, I'm sure all of you have had something that's drawn you to healthcare for whatever that may be. And it's something that just really filled my cup. And I don't know if any of you are familiar with the Work U program that you guys have there at BSU. Yay, nay, maybe. So if any of you have an opportunity to go through the Work U program, I highly recommend it. That's what really pivoted my career trajectory into St. Luke's. So I ended up getting partnered with St. Luke's as an intern for roughly 6 months. I had a fantastic team that I worked with, and I was actually studying to take my MCAT and go to medical school, and thought in the meantime I'll get some insight into St. Luke's and healthcare. And I was working on the workforce planning and management on the physician services side, and ended up loving working on the administrative side. So again, just goes to show, just have an open mind. You never know what's going to happen. And I think that moment is really what propelled me into HR, which HR is, has so many different areas under it. It's not just human resources and compliance, right? There's operations, there's talent acquisition, talent management, development. So I like that because you can really grow into so many different departments and areas. But again, if you're drawn to a role that's going to connect you to people and purpose, I highly recommend healthcare for that reason.
Anita, Brady, anything either of you would like to share?
Yeah, I mean, I actually segued to healthcare about 4 years ago. So my background originally was actually in city government. So I worked in city government for almost 15 years. But really truly on the kind of the community programming, community development side. And that really got me plugged into the community quite a bit. And how I ended up with my opportunity with St. Alphonsus. It's to kind of what Anita was saying, filling your cup. It absolutely, I get a little bit of patient interaction. I get a little bit of I get a lot of opportunity, but really, truly, it's great to see the impact you can have on your community, whether that's through my providers that are, serving patients or, my social worker staff, and their interactions. So, it wasn't a planned thing, but I'm so thankful that I am where I am and the population that I get to serve.
I guess I'll add a little bit to that, but for me, I think a lot of it was I had such great opportunities at Boise State that I really leveraged the network that I was able to build and all the connections that some of the faculty at Boise State help get me connected to, and I use those connections to kind of see what was out there, and then I was comfortable with just saying yes to different opportunities to kind of try different things while I was in school, and that kind of led me to where I'm at today. Is I got to try something new, and I saw that public health was something I was passionate about, and it led me into a career that I kind of get to use a little bit of public health, a little bit of healthcare, health informatics knowledge that I already had. So I got a little bit of everything just through trying different stuff.
I'd love to kind of lean into the end of that question or something you touched on, Anita, which is networking. Networking is a word that tends to have a lot of maybe feelings that come with it or a lot of assumptions. And I would love to know from anyone on the panel, what are tips you might have about networking, or Anita, if you could lean into and discuss a little bit about what networking looked like. Anything to help give the students on the call kind of some advice and some motivation to leverage that network that they're already building.
Yeah, definitely. So I think back when I was a student, the main way I would do is whether it was through a class project or if it was, maybe a career opportunity, just email somebody who works at that organization and show your interest. Not most of the time they're willing to have that conversation with you or find someone that they can connect you to. And all you got to do is ask a couple questions of why they may like their career, what they do day to day, and it kind of helps you guide you to understand if this is something you may have interest in, maybe not, but you've built this connection. So while you're applying for jobs, you now have somebody that works there and you're more than welcome to reach out and be like, hey, just want to let you know I appreciate our conversation we had a couple months ago. I'm applying for a job here. Do you have any advice? They might be able to give you some tips depending on how the hiring process works for their organization. Or they just might be able to give you a couple pointers while you're going to go interview and all that kind of stuff. So I think it's just reaching out. Most of the time, people are really nice and they really like to talk to you and love to. You're letting people talk about themselves. So might as well give them that opportunity as well and just reach out if you can find a contact or ask a professor. They always have contacts that they can happily give out to help build some connections.
Wonderful. Thank you, Anita. Julia.
Yeah, so I think a few points on this. So first of all, if I was in your situation, if there's an area that you're interested in or a role, even if you're interested in HR recruitment or talent acquisition, I'll drop my email into the chat so you guys have that information as well. But I recommend doing informational interviews. I did a few of those when I was in college. I even did them when I entered the workforce when I was new to St. Luke's, just to learn more about what people are doing in my network. So informational interviewing is always a great way to make a connection, a natural connection, but also learn what that individual is doing. So you're gaining some information and important resources that you can take forward in deciding what maybe you like and don't like, as you move forward in your career. Number two, building really strong relationships is extremely important in networking. Anyone that you're working with, maybe you're partnering within a project, even in your classes, if you guys, enter the workforce, you probably may run into someone that you went to school with at some point, right? That's happened to me. all the time, especially being a BSU graduate. So don't underestimate the ability of building relationships with individuals that are around you on a daily basis, because it will provide networking opportunities and open doors for further conversations. I do recommend, lastly, getting involved in groups. That's a really great opportunity to meet like-minded individuals, leaders in the community. There's some youth leadership clubs within the Treasure Valley, Facebook groups, on LinkedIn, there's opportunities to join groups. So any way that you can get involved with a group of people that maybe are interested in similar things that you are interested in, that's another great way to network.
Wonderful. Thank you. Brady, did you have anything before we move on to the next question?
Nothing more to add. I think those are all great points. So thank you both.
Wonderful. Would you say are some of the most important skills that you've developed throughout your career? And I'm going to tack on to this. What are some things that students can do now to help develop those skills or recognize that they're skills that they're already developing?
Could you repeat that question, please?
Oh, yes. So what are some of the most important skills that you've developed throughout your career? I guess what I'm saying is how can like students work to develop those skills, maybe to help make them more competitive for those careers, or even to recognize that they're skills that they're already developing maybe in their coursework?
I would say skills that I've developed and fine-tuned over time. And no one's perfect, but we strive for excellence every day. So this is definitely a learning curve for everyone. And I've been in this job for 6 years now, but I still learn something every week, every year, right? So take that information as well. But I would say communication is number one. Especially working in the industry that I am. I'm talking with people on a daily basis. It can be very candidate heavy on a day-to-day basis, or it can be really leadership focused. So that just depends on my day. But again, written and verbal communication is essential. Organizational skills and time management. I'm assuming most of you are health sciences in that area. And I remember taking a project management class when I was in school and thinking, how is this going to be relevant at some point? And I would say project management is a huge part of the work that you're going to be doing in the future. So, time management skills, how to deliver those deliverables to your leadership, whatever you're working on, making sure that you're working towards that shared goal with the team. I would say have a positive mindset and be curious. I think being curious is going to continue pushing you naturally to always be learning. Being coachable is important as well. That's something that I think you gain over time too, but being coachable is definitely important so that you can change with whatever, if you're in a healthcare system, for example, like I am, healthcare is always changing. You have to be able to pivot and move with the trends and the times. And then also just being a good listener, being empathetic, and emotional intelligence is another one. So soft skills are important when you're working with people. You may have the technical skills and know how to work the software and the program, but when it comes to people, it's really important to be able to know how to connect and work well with others.
Yeah, you stole a lot of good ones there. That was a great answer. I would just say, it's so true in healthcare. Always being willing to learn. There are so many different pathways and new things to learn and changes that will come. So that adaptability is really key. In my world of operating 4 clinics at 4 different sites, triaging priorities and just kind of managing expectations, and doing so really truly with a positive mindset for myself and my team. And And then I would say just with managing people, it's super rewarding, but it also can be super, super challenging. But listening to understand rather than listening to respond is, I would say, probably my biggest thing that I will remind myself and other colleagues as well. It's so easy just to throw out a quick response, but are we truly understanding the question that's being asked? Especially as you're dealing with, patient safety situations or, customer complaints or interpersonal conflicts. All of those things kind of fall under that listening to understand. So yeah, that's all I'll add.
I'll add one little quick thing just because they've said a bunch of super important skills, but the one thing I would add that is pretty applicable to the work that I do, I work with federally qualified health centers across the state. So I've got to see many different communities, and it's just important to understand the communities that you're serving and the communities that you're around and what their needs are, because it really can change where you're located and who you're helping and what impact you will have. So understanding the community that you're a part of makes a big difference.
Yeah, Julia.
One more thing to add on that. I know we talked about, the skills that you gain over time, but ways that you can put this into action. Again, what I mentioned, informational interviews, getting involved in groups, any internship or volunteer opportunities are really great as well. I know, internships and volunteers aren't typically paid, but that real experience that you can gain in that is invaluable. Any job shadowing that you can get involved with, and then also any campus. I'm not sure what they have on campus right now, but any campus involvement is going to fine tune those skills for you.
Love it. That was such a good answer, friends. We have a question from the chat. Where can students look for healthcare jobs that are not direct patient care?
To take a stab at that question. So like I mentioned, I'm in a little bit of a unique position. I work at a membership organization that serves, like I said, federally qualified health centers. So these are low income clinics across the state. They're federally funded and they serve anybody and everybody who needs healthcare. However, there's so many more jobs than just like the clinician side. We have community health workers, we have outreach and enrollment teams, we have quality improvement staff. All these people work together to ensure that the patients are getting the best care that they possibly can. And they're not working on the clinical side, they're not working directly with patients or in the medical field, but they're adjacent to it and doing a lot of important work that is necessary for this to happen for the patients to get what they need. And I also am a big advocate for public health. I have my master's in public health, and health education, prevention, intervention are other really great areas that you can dive into, whether that's your local public health district, the state, nonprofits. There's so many ways that you provide health care or care to others without having to be on the medical side.
Yeah, like Anita said, there's so many opportunities that you can get into that you don't have to be face to face with patients. But just to name a few and where you can find these opportunities, for where I work at St. Luke's, you can go to our careers page. You can filter based on location, categories that you're interested in. Maybe, if you want to work full time or part time or flex, which is lower hours, typically pretty flexible with student schedules, but you can look on the categories that are non-clinical. It'll be administrative, professional, health information management, but all of those will be listed underneath there, and that's where you can find those. But if you're needing some guidance on where to start, I would say patient access specialist, which all healthcare systems have these individuals that work for them. These are the patient support roles. And although you don't need to be working, in the back rooms with the patients, you can be checking them in, collecting their, demographic information, insurance verification, scheduling. They even have these roles where you don't need to work in a clinic or hospital, or you can work, and support patients via phone and computer. So again, I'll drop in my information. So if you guys have any further questions on that, we can connect. Actually, looking at a few of your names, I feel like I've actually connected with some of you at our BSU career fairs as well. So you probably heard me chat about that as well. But yeah, Dalton's like, yep. But that's what I would recommend, and just make sure you're going to the careers page of wherever you're interested in and searching based on categories that way.
Julia, oh, sorry, Brady, did you?
Go ahead. No, you're good.
We just had someone follow up when applying for positions, what things do you want to see on resumes? And anyone can chime in on this as well.
Yeah, so on resumes, you'll want to make sure that you're, for us specifically, we are interested in seeing your full work history. We want to see, education that's been completed. We want to see any projects you've worked on, any volunteer opportunities. Um, we also want to see why you're interested in the position, what skills that you have that may be unique compared to others. And I think a really important thing with resumes too is just making sure that they're clean, neat. Um, you know, I always say this, but no pictures, keep it, pretty clean, black and white, and just keep it kind of a good flow. So if you were reading it, it's kind of like a book, right, from beginning to end. So the bottom should kind of tie it up a little bit, is how I think of it. But does that answer your question?
I think so. It was one that was sent in the chat. Um,
Okay.
Anyone else have anything to add about that or the previous question, Brady? I know I cut you off on there. I'm
No,
sorry.
you're great. Yeah, I'll trust your recruiter on your resumes. They do get forwarded to me quite a bit. But succinct is absolutely important. And but yes, include all of your history because so much of healthcare we look at years of service and things like that when it comes to like compensation and things like that. So when a candidate excludes some of that, it's sometimes harder or they get lowballed on a number. So kind of look at that. But I would also just say, and I'm sure it's similar with recruiting at St. Luke's, and just so transparency, I'm a big fan of Luke's and Al's. My partner works at Luke's and I work at Al's, so we're a house divided. But we love both. But work with your recruiter too. Like oftentimes if you're applying for a position and you have a good recruiter and they find out what you're interested in, they can tell you other things that are coming down the pipeline. If you weren't selected for that position, that round, they can keep an eye on things for you in the future. We've got a couple of really good recruiters that I know have sent me candidates of saying, hey, they applied for this opportunity, but I actually think they're going to be a better fit for you over here. So get to know your recruiters, chat with them, let them know your interests. They can be a great advocate for you as well. So.
I would also say leverage the resources you have on campus. Career services will meet with you and they'll look over your resume. I've worked with Kelsey plenty of times on many resumes and cover letters to have her help me get prepared for jobs. So use the resources you have available on campus. They're great.
Thanks for the plug. No, these are all great. Um, this is just more of a general reminder for everybody who is on the call. If you have questions, please feel free to send them in. I'll take a pause here though. Does anybody from the audience have any questions that you'd like to ask? If you want to unmute yourself, we can ask our panelists. Okay. Okay, we'll keep going then. What do you wish you could have done differently in college that would have better prepared you for a healthcare career?
I That's a really good question, Kelsey. Um, when I first entered college, I knew I wanted to be in healthcare. I think I just didn't have a solid understanding of which sector I wanted to be in. And when I first joined, I was so, I think, focused on I have to choose this type of degree because I want to go into, psychology, for example. And I think I kind of narrowed myself in that way. So, eventually I was able to, get to where I need to and, figure out that whole process. But I would just say that although you probably know what you're interested in and what you want to grow in, but just have an open mind because you just never know what's going to happen. Um, There are so many positions in the healthcare system that I remember when I joined St. Luke's, I heard of things that I've never heard before in my entire life. So, um, and so you just don't know where your career will go. I think saying yes is important to opportunities. Um, and so that would be my piece of advice. I would say just have an open mind.
I would just echo that. Continue to be open. I mean, just in the world of oncology, there are so many different options that are non-patient facing. Financial navigation, physics. I mean, there's just it's so crazy. So just continue to be open and when you meet those people who are like, "Oh, what do you do?" Just ask them. They'll happily talk about themselves. Trust me, and the work that they do because there's a reason that they're doing it, right? So.
Yeah, I agree with all of them. Just be curious and be open to new opportunities. I would have never landed where I am now without um, making these new connections and kind of putting myself out there in a different way. So say yes if you can.
Wonderful. Oh, I love the advice that you all are sharing. Thank you again. What are the most rewarding aspects of your roles?
I would say for me is the work that I do at the association trickles down to the centers and trickles down to some of the most vulnerable people in the state of Idaho and to the communities who truly need the most support. I feel like that's the most rewarding way to look at the work that I do is it takes so many teams working together to get the work that we need to get done. And it's really nice to know that at the end of the day, these people are being seen and being taken care of and have the support that they need because they're the ones who we need to support the most in our community. So I'm happy to be a part of an organization that can do that.
I would say the most rewarding for me is, on a weekly basis, I'm helping people get into meaningful jobs. And healthcare is a sector that you can easily be in this for the rest of your life, right? So you just never know where that journey is going to go for people, even for you, right? The possibilities are endless. Never say never to anything, right? You never know. But I think getting people into those meaningful jobs for them and knowing that those jobs, and you also have to understand the bigger picture, right? Because those jobs are helping keep our community healthy. And in a healthcare system, that's our mission behind everything is to serve our community and keep our community healthy and be proactive with that. And um, I love seeing an individual that I hire thriving in their role. I, do quite a few site visits and I'll go see an individual that I hired from 2 years ago, 3 years ago, 6 months ago, and just seeing them happy and, work in their department and that just never gets old. So the impact that you're making is pretty substantial.
Yeah, I will just say, in my specific role, it's rewarding in the fact that, cancer doesn't discriminate. That makes it hard. But supporting my team, I'm really truly in an operational role, to keep the clinics open and running and staffed. But we really try to look at the patient as a whole. So even at the beginning of a diagnosis, they meet with a financial navigator who again is not a clinician, who helps them make sure that they understand their insurance and the financial burden. So we're taking care of the whole person, not just their physical health, but their mental and emotional well-being health as well, with social workers, dietitians on staff, things like that. So for me, there are a lot of sad days, but there are a lot of really, really, really rewarding days for all of our patients. So it's really just really supporting my team members so they can help support our patients in the best way possible. And I don't just mean their physical health. So.
Okay, and now you probably saw this coming. We're going to flip it. What are some of the biggest challenges that you see in your role, and what keeps you motivated throughout those challenges?
Like I mentioned, I work with about organizations across the whole state, and every clinic or every health center has different needs. So it's just trying to navigate how to support. You want to be able to support as many as you can, especially because we're grant funded. So you're using limited resources, limited funds to do this work. So you have to get pretty creative sometimes with how you can provide support and just trying to figure out, they need this, but they need this. What can we do to kind of help everybody meet their needs? So I think that's like the challenging thing is everyone needs something different, but you want to be able to provide support to everybody who needs something.
Yeah, I would say that biggest challenge would probably be workforce shortages can be hard in some areas. You know, naturally, some positions are harder to fill than others. There's a lot of factors that can go into it, but in Idaho, we have a lot of rural areas, and St. Luke's, we have 8 hospitals, almost 400 clinics, and so those do spread into rural Idaho. And if any of you are interested in rural health, that's very rewarding work, right? Some of the most appreciative people that I've worked with in those rural areas. But um, balancing urgency with quality is also a challenge as well, because you want to make sure that you're getting the right individual in there to provide the needs for that rural area. But um, at the same time, you just can't move quick on it. So I think, again, just having a positive mindset, and what motivates me is just knowing that the team that needs your help will eventually get that help, and that's on me, right? So I have to stay positive. I have to be the team leader, is like, we are going to get this filled for you. So I think really just being a trailblazer and a leader in that aspect, and just staying positive, is really important. No matter what role you're in, you definitely want to be have that mindset.
Yeah, I think for in my role specific, I think physician recruitment to Idaho is really hard. And I think that we're doing our best. It's something that I can't always fix. And I don't have a solution for it, but staying positive, supporting the team. But it does drive a lot. I mean, we're talking about, the population that's moving into the greater Treasure Valley area is only going to grow, and continuing to recruit quality physicians to support our patient population is something that we'll need to address a lot in the next 10 to 15 to 20 years and today to support all three of our, our services. So, yeah.
Somebody asked about some hidden gem health careers that they may not know of that they should look into.
Oh, what are you interested in? I would go back with a question. I mean, there's so many great things. I mean, for instance, there's one, we have tumor specialists here in the Cancer Institute. It's such a unique role that when I first started, I had no idea what they did, but it's like data collection for anyone who presents in the ER ends up with a cancer diagnosis. We have to track it for the state. So you could be data and analytics for kind of tumor diagnosis within a hospital system. That's something that's super unique, not patient facing, but that team is so smart and so mighty, and they know so much about oncology, and they do great work. That's just like one that comes to mind, but I would have to flip it back to the person and say, what are you interested in? What do you like to do? And we can find something for you.
And I believe this person is, leaning towards a non-clinical career path. So especially thinking about with healthcare, a lot of the times the jobs we think about are, clinicians. So I guess I'll expand the question a little bit to any non-clinical position that people might not know exists that they could look into, whether it be after graduation immediately or, down the road with more training.
There,
Uh,
oh,
Go ahead. No, go ahead, Anita.
there's plenty of opportunities. I personally, and I think three of us here, none of us are in clinical positions where we work. I work as a data specialist for an organization, so I do run data and I make visualizations of a bunch of clinical data, but I'm not one of the clinicians. I used to work at St. Al's, and I worked in their medical records department. So there's opportunities if you are interested in electronic health records, health informatics. Kind of like Brady was saying, that's a whole field that you can go into. If you want non-clinical, but still somewhat patient facing and being more like closer to like patients, community health workers are a great opportunity. You're connecting them to a lot of their social needs, whether that's they need help with transportation, food, connecting them to other care resources. You connect with patients, but you're not providing clinical services. There's a whole variety of roles. Most healthcare organizations, a lot of the backbone work is done by administrative, non-clinical positions to make sure the clinics can run smoothly. So ton of opportunities depending on what you're interested in.
Is anyone on here former sports or loves athletics, currently plays an intramural or anything like that?
Oh, I'm sure
Maybe?
we have them on the call.
Yeah. So I want to highlight our Center for Orthopedic Sports Medicine. I think there's a lot of opportunities in sports medicine that, you know, if you have that type of background, there is a place for you in healthcare. Specifically, I think of our concussion clinic. I don't think a lot of people, you know, unless you've been in sports or have had a concussion, or maybe you know someone, a family member that's had to go to a concussion clinic, you know, we have that. So it's not a patient-facing role, but if you're interested in research and you know, staying up to date on state and you know national procedures of return to play and how to treat athletes and how to support in that way, it's a really awesome and interesting position. I'm a sports girly, so I love anything athletic training. I know BSU has an athletic trainer program. If you guys have heard of that, that's kind of where that would bridge in that way. But we have roles that in our concussion clinic that you don't need to be an athletic trainer. You can just, you know, as long as you're willing to learn and have a passion for healthcare, that's what they're looking for. And again, if you're interested in research, you know, they do a lot of yearly conferences. You know, we even host our own, so lots of opportunities for growth in that department and you know, learning about state compliance on that.
Wonderful. Somebody put in the chat, when should undergraduate students start preparing for that end goal of finding and getting a job?
That's a good question. I think it depends on what type of role you're interested in going into. You know, some positions may require a master's degree and a certification. And, you know, I think those qualifications that we're listing on our job postings, they're pretty black and white. You know, if you don't have the certification, you're going to have to earn the certification prior to applying to that position. You'll see, for example, bachelor's degree or 4 years of relevant experience. So if you don't have your bachelor's degree, you can replace it with 4 years of relevant experience. So just to just give some examples, but I think it depends on what you're going for and, you know, basing your timeline, again, time management, you know, when you should be applying for that. I recommend, you know, for example, if you're graduating this May with your bachelor's, start now. You don't know, you know, how many interview processes you may need to go through, applications you may need to go through. I think we've all experienced kind of getting through a couple no's before you get to a yes, right? And that's anticipated. But I always tell people, stay positive, do not feel discouraged, and can just continue to apply and get your application in, because it's also a numbers game too, right? You got to make sure that you're getting your resume in front of recruiters. Again, the more that we're seeing your name, you know, like others have shared on the panel, those connections will be made. Our recruiters, you know, will reach out to you and say, oh, maybe not for this one, but maybe for this one. And leaders also speak like that on the back end as well. If they interview an individual, they'll say maybe not for this position, but maybe for my partner over in, you know, data integrity, for example. So I recommend as soon as you can. I think if you're going to be applying 6 months out from graduation, that might be a little bit too far, especially if the position does require a bachelor's. So just be mindful of that. But it just really depends on the requirements of the role.
Anyone else before we move on to the next question? Okay. For the alumni on the panel, have you felt, or how have you felt, excuse me, your degree from Boise State has set you up for success in your career?
I'm a big advocate for Boise State School of Public and Population Health. I feel like the opportunities I got through both my undergrad and my master's at the school, at the university, have truly helped me end up where I am today. I've had great faculty and advisors, and I've really leaned on them. I think I made sure to connect. I'm going to shout out Jamie. Jamie is my undergrad advisor, and I always went to her whenever I had questions or things that I wanted to discuss. They know how to help you, whether it's with classes, internship opportunities. I really leveraged those resources while I was in school to kind of help me get where I'm at today, because I dabbled in a couple different things, so it kind of allowed me to have a variety of things I saw before I graduated. But I think for me, it was just like using the things that I had while I was in school, like my advisors, my faculty, internship opportunities. I know those have been mentioned. Those helped me land where I am today, because I had a number of things on my resume that I could attest to even when I was a student. So I think those are super helpful.
I felt that my bachelor's of science built a really great foundation in understanding how healthcare systems work overall. Um, all the way from public health to patient centered care. So, all of the things you're learning right now with healthcare terminology, again, project management. I'm assuming some of you have taken organic chemistry. If you have, I feel you. um, and I think sometimes there is the question of how is this relevant in the future? And, although in my current job today, I don't need to know, the composition of molecules and how much they weigh. But I know that the person I'm hiring over in pharmacy is utilizing that information for drug research and development, and there's a connection, right? And again, I think I go back to saying this, but it's about understanding the bigger picture of how your knowledge extends to, others in your system and how you're all working together on that shared goal. But again, I really felt that my bachelor's of science gave me a really great holistic understanding of how a healthcare system works from clinical to non-clinical.
Okay. This is going to be interesting, just because you all are in different roles. This says, or this question is, what are the emerging trends in your industry and how are they impacting your individual roles?
Value-based care is huge in healthcare, whether it's hospital or a smaller clinic like the health centers that I work with. Value-based care is, I would say, one of the biggest emerging trends, where rather than a provider's just giving a patient a service, it's making sure it's providing that whole person care, like Brady was mentioning earlier. Do they have access to care? Do they have access to the resources they need after they're out of the facility? It's really looking at all of that and making sure they're receiving quality care. So I would say value-based models is something that's emerging through many different sectors of healthcare that I've seen since I've been working here.
Can you repeat the question, Kelsey? Sorry.
Yeah,
Or
no, you're
last part.
you're good. It's what are the emerging trends in your industry? And what, how are you seeing that either impact you, maybe your clinic? But yeah, just what are the emerging trends that you're seeing?
Yeah, I think I mentioned earlier, physician shortages, it's a trend, for sure, especially with medical oncology in particular. But that also, care changes so quickly. And again, that's not always just on a clinician basis. That's also how we support our, clinical providers. Genetic counseling is changing a lot in the framework of oncology and how we're treating patients. And so that's really truly kind of creating a whole different way we're getting patients in through high access clinics. So, and risk screening through genetic counseling really early on. So that's a lot of, again, non-practitioner clinical led work as far as getting high risk patients in to get screened through genetic counseling prior to ever having a cancer diagnosis. So we're expanding our high risk breast clinic right now. And that's not your, mammograms and things like that. That's just truly genetic risk factors and getting people in sooner to prevent or to have more knowledge there. Yeah, those are some that come to top of mind. I'm kind of rambly, sorry.
Please don't apologize. That's great.
Yeah, so piggybacking off of both of you two, um, ditto to what everything you just said. I do also recruit for providers, so I can agree that the workforce shortage is a you know, always a trend right now. And I think what that comes down to is, you know, why Idaho, why us, when there's the same position open, you know, 500 times across the nation. So I think when you get into your role, just learning how to be different and have some unique approaches, being collaborative, open-minded, creative, and how you can bring, you know, something to your team that's can help with, you know, problem solving. Um, I would say another thing that's newer, trending is technology, AI. That's huge. I know that's a hot topic right now, but you know, historically, there's been, you know, evolutions and technology and tools and resources that we're using in all of our industries. So I think staying on top of that, I recommend definitely having a pulse on that, get familiar with it, learn it, because it's going to be a part of your role in some sort of way. Um, Telehealth is also big too, right? Especially for our rural areas, being able to provide that care to, you know, patients that are, you know, really far out. Maybe they don't have access to come into a facility. You know, getting creative with ways to provide that. And then workforce flexibility. We saw this with COVID. You know, just trying to you know, provide the best roles that we can, and then also you know, have that workforce flexibility, because that's really important to people nowadays. So having that flexibility with their schedule, you know, if kids are sick, can we go home? Can we pick them up? Can we work from home? So just kind of flexing with the needs and looking at the trends of what people are interested in as well.
Those are all great answers. Thank you, panelists. Let's take a pause here. What questions do we have from anybody who's joined on the call?
I had a question, and maybe the panelists can speak about the different platforms where the students can actually go looking for jobs, you know, and how do they navigate these different platforms and make things a little bit more streamlined or easier for them to be able to find the right job.
Yeah, so I recommend going to the career page in the organization that you're interested in. And I recommend doing that quite often and doing that now. I think one of the best pieces of advice that I got when I was younger is start looking at jobs now, even if you don't qualify for them, but look at what organizations are hiring for, what's available in your area. You know, because maybe something that you're interested in isn't maybe super common here, but really common in, you know, other organizations, especially if you're in a non-clinical position, that could be applicable to other industries as well. So, but I would go directly to the careers page again. So, for example, St. Luke's career, St. Alphonsus careers page. So, I recommend using that. Indeed is always a resource. You know, we post on LinkedIn as well as recruiters, but I tend to direct people to stay away from the third-party vendors. There's sometimes information, well, not sometimes, often there's information on Indeed or Monster Jobs that is not accurate information. That's not information that, you know, St. Luke's or St. Al's on our end can change that. For example, pay scales can be very inaccurate. You know, just for example. So that's why I say just go directly to the source.
Something that helped me when I was looking for jobs is if there's organizations that I was interested, so let's say St. Luke's, St. Al's, or even like the state, you can subscribe to where they'll send you email blasts kind of with things that you're looking for. So that's another way just to kind of keep a pulse on what you may be interested in without having to go to the website every single time. But I agree, go straight to the website of the organization you're interested in rather than some of the third-party vendors, because they could also be outdated and that position could have been filled and then they hadn't removed it from the website yet. So the most up
Yeah.
to date would be on their own portals.
Yeah, Anita brought up a great point. Those email campaigns that you can sign up for that and you can choose by category. So for example, if you're interested in administrative roles, you can sign up for anything that falls under that category and they'll shoot an email to you about, hey, this is the new job posting. I highly recommend that because if you are actively searching, it is difficult to go on every single day and look at what's new on each job site. And some of these positions could already have been open for, 60 days, and then you apply at the end of the 60 days and we're already interviewing and wrapping up that position, right? So you want to stay on top of it as well.
What other questions do we have for our panelists? Okay. Unless, oh, I'm so sorry, my email is blowing up. So I have two more questions, unless there are any from the group here, from the people on the call. Someone wanted to know what the day-to-day was for each of your roles because they are so different. Yeah, what's the day-to-day for those roles?
My day-to-day is different, which I love. There is definitely variety in being a recruiter. I could be meeting with hiring leaders all day and focusing on strategy of how we're going to fill certain positions or coaching them or mentoring them on best practices to follow when reviewing applications. There's a lot of, ethics that go into that as well, conducting interviews, how to collaborate with other teams to, potentially, maybe we can work together to fill a position. But other days can be very candidate heavy, where I'm having calls with candidates throughout the day, getting to know people, what they're interested in, helping them, find their career within St. Luke's. So I would say day to day as a recruiter is very different, but mainly you're going to be working with leadership and candidates and building those long-term relationships on both sides.
Yeah, mine is I like variety personally. That's kind of why I'm in the the role that I'm in. So typically there's a couple of constants no matter what. We do daily huddles with our teams. So they get to see myself or another one of my leaders kick off the day every day. So a lot of it's operational, a lot of it's rounding. I have an hour blocked in my schedule every day for some sort of rounding where I get around with team members just to help observe, work with them, be a resource for them. Some days it's really strategy heavy, and we're talking about building a new, so we'll have two new cancer institutes in the Treasure Valley as we grow west as well as here in the Boise campus as we continue to grow and expand, because two of our sites are really at capacity as far as what we can treat. Again, growing valley, good problems to have, but so I get stretched between operational needs and strategy needs pretty consistently. No 2 days exactly the same, but again, I like that. Sometimes there's a patient safety event that I get pulled to, so you got to have a little bit of unpredictability in the day as well. But it's not just sitting in my office, which I also really love. I'm on my feet a lot. I'm rounding a lot. I get to do different projects or different initiatives. I get to work with community health sometimes. I get to work with different programs and foundations and things like that to serve patients. So there's a lot of opportunity for spontaneity if I so wish. So.
Like I mentioned, I work in population health. I'm a data specialist, so a part of data, it falls into a lot of groups. So for me, the exciting part is I am a part of a lot of work groups with each of the health centers. So I have calls constantly about quality improvement, population health, value-based care. We talk a lot about coding and operations and how that data works. So I get to have conversations and meetings on a daily basis with my internal team, with the health centers. And then since we are a national organization, I do get those conversations with people across the country as well. So it's fun to collaborate with people on so many different levels on top of my day-to-day work of analyzing data and all that kind of stuff. So I love the collaboration that I get to do, and it varies day to day, which is nice.
Okay, last question. We've only got a couple minutes left. What's a final word of wisdom you have for students, as we go about the rest of our week?
It's exciting to be where you're at right now. It may not feel like it is, but be a sponge, find a mentor, have someone to reach out to and bounce ideas off of, mock interview with. It's a fun time. Find something that you're passionate about. It's so many options, and I know it can almost feel daunting at the same time, but looking back, it can be a lot of fun as well. So just enjoy it, be positive, put your best foot forward. Yeah.
Yeah, piggybacking off of that, I'm just going to say go for it. And I like your Believe poster in the background. I'm a huge fan of that. There's a quote from that show, if any of you love Ted Lasso, and he says, "Be a goldfish." Do you guys remember that? And he's like, "Why?" And he says, "Well, because a goldfish have a 3-second memory." So have that mindset if something bad happens, it's not a result that you thought about. Don't get discouraged, have that goldfish memory and just keep moving forward and strive for what you're passionate about. Again, be open to opportunities. Be a yes person, and in the obviously in the spaces that you're interested in, and you just never know what can happen. So I just say go for it. It isn't a very exciting time. I remember towards the end of college, it's a lot going on, right? And it's a lot to process as well, because it's like, okay, I'm really stepping into the workforce. What am I going to do? And you don't need to have everything figured out. I still don't have everything figured out, to be honest with you, right? It's an ever-changing process. You're still learning, and yeah, just have fun with it. Have so much fun with it.
I would just say be proud of yourself, and remind yourself that you are where you need to be. Rejection can be hard, but it also gears you into the direction that I think you're supposed to go. You'll end up in a career that is meant for you. I was in your shoes just less than a year ago, so I know what it's fresh in my mind still, the whole process. But be patient with yourself and be proud of yourself. You worked really hard to get to this point, so remember that as you go through the processes, you'll end up in a great spot. So just know that your value, all the things that you can do are amazing. So be proud of yourselves.
Thank you, everybody. Thank you, Brady and Julia and Anita, for joining us on the call today. Thank you to everyone who has joined the call. We really appreciate you taking the time out of your week to join us today and share your advice and insight for our students. Thank you, everyone. And this concludes our panel.